Hi, Mike Gibson, Holger Thiele here, and we're talking about a new patient-level meta-analysis of mechanical support in cardiogenic shock. Holger, what did you find?
Yeah, so we have performed now after we have the large-scale active mechanical circulatory support device randomized trials. We have ECA shock, which did not show a benefit. We have danger shock, which currently is the only randomized trial which showed a benefit. And then we have several other smaller trials which also compared VA ECMO versus control. We also have some trials comparing tandem heart versus control, and we also have some smaller trials comparing impeller versus control. And that's the reason why we decided to perform an individual patient data meta-analysis of all the randomized trials that have been performed so far on active mechanical circulatory support versus control. And altogether, we included 9 trials, having 1,059 patients included in this individual patient data meta-analysis, comparing active MCS versus control. And we had three predefined analyses or major analyses in this IPD meta-analysis. So first of all, we look for MCS versus control. We look for ECMO, so loading devices, versus devices which perform unloading like impeller or the tandem heart. And then we also performed a specific analysis on danger shock-like patients, so STEMI patients without having a risk of hypoxic brain injury. So for all these 3 results, we found interesting results. So for the overall population with acute myocardial infarction and cardiogenic shock, an active mechanical circulatory support device is not reducing mortality based on the 1,059 patients we have included. If we compare ECMO versus control and also unloading devices versus control, ECMO does not reduce mortality, but also those patients having or getting an unloading device like impeller or tandem heart, they do not have a statistical significant mortality benefit. The only mortality benefit we could find is for those patients like danger, so danger shock-like patients. So these are patients with STEMI. So it's important, these are not non-STEMI patients. So STEMI patients without having a risk of hypoxic brain injury. And probably this is also important for clinical practice because we all believe that these devices are beneficial, but this is at least what we can learn from our individual patient data meta-analysis. That's probably only those patients having a benefit without the risk of hypoxic brain injury. And this is probably the most important what we have learned from this individual patient data meta-analysis. And after now Recover 4 has been stopped, probably this is also, maybe not sure if it is a definite answer, but probably for the next 5 years, this is the most important data we have for mechanical circulatory support.
We got to give the right treatment at the right time to the right patient.
Exactly. This is the correct interpretation. Yes.
Yes. Holger, tremendous contribution to the field. You worked at this for a decade now. Thank you for all we've learned from you and everyone else. Thanks for joining us today, and thanks to all of you for joining us here live from ESC.